So Dr. Bayless, thank you for joining us. We're excited that you're here. We are going to still do your recorded presentation, and then you can take some questions and answers at the end if we have some time.
Hello, everyone. I'm so happy to be here, even if I can't be live right now. I am currently teaching, so I hopefully will be able to wrap up class soon and make it over here for the Q&A portion. Today, I'm really excited to share some very preliminary work coming out of my lab that examined parental childhood experiences and infant sleep. And specifically, I took a social determinants of health perspective and understanding the intergenerational transmission of health. I'm Dr. Lauren Bayless, and I am currently an assistant professor at Oklahoma State University. And like I said, I'm very excited to share this work with you all today. So just for some quick context, my program of work largely centers around understanding predictors of caregiving behaviors. Specifically, my work is focused on examining cognitive and emotional processes that parents have in understanding why they engage in certain behaviors. However, I'm also interested in how parents' early experiences or their developmental history also shape their own caregiving behaviors. Of course, unpictured on the right side of this model, I have effects on infant health and infant well-being, in particular in infant social and emotional development. But generally, I think about parenting as like kind of the core of what I study. Overall, I'm pretty new to the sleep world and the new to the sleep research. I have a few published collaborations that have examined adult or caregiver sleep in relation to the parenting or the context of parenting. So, for example, during my PhD with my advisor Esther Lurkes and a sample of undergraduate students, we found that even one night of sleep deprivation was associated with decreased inhibitory control, which is an important cognitive process when engaging with infants. This was in turn associated with distorted cognitions about infant crying and decreased intendedness to respond to infant crying. And then when we look at this in parents, we found that in a sample of biological mothers who reported higher levels of sleep problems were more susceptible to challenging infant characteristics, such as negative emotionality when engaging in food to soothe behaviors with their infant. And we know feeding to soothe is an obesogenic feeding practice associated with an increased risk for childhood obesity. So taken together, these preliminary findings from work I've collaborated on have shown that sleep difficulties or deprivation have implications on caregiving behaviors, which leads to the next reasonable question I think that we should ask is what causes sleep problems during the early postpartum period? And I think this is a funny question because there's the scientific answer that we can certainly go about looking at empirical data, looking at what the science suggests. But then I also think there's a probably pretty easy, straightforward answer, and that's infant sleep, right? At its root, infant sleep, I believe, is the culprit of a lot of sleep problems in caregivers, especially during this early postpartum period. Infant sleep, in particularly during this early period, is supposed to be disrupted. Yes, infants sleep a lot, and newborns sleep a lot, but they also wake up a lot, an average of 15 times per night, according to one study. And yes, sometimes these wakings are due to physical needs, so maybe baby's hungry, or they're wet, or they're cold. But sometimes infants wake up because they just startle or because they aren't able to connect sleep cycles yet and they get into a light period of sleep and they're not able to go back to sleep themselves. So, disrupted infant sleep often results in disrupted caregiver sleep. And given what we know about the importance of sleep in adults, it's difficult to be our best selves when we're running on a few hours of sleep that was largely disrupted. I'm a new mom myself, and I remember greatly how awful I felt during these first few months of my son's life, trying to function and be a good parent with less than great sleep. Luckily, my 9-month-old son now sleeps wonderfully, but I remember very clearly and not very fondly looking at my Nanit app in the morning and seeing, yes, we were up every 45 minutes last night for 12 hours straight, and it made for a really, really tough day. Thus, I think it's really important that we understand factors that promote high quality infant sleep in order to promote better family functioning and mental health within the family. In my postdoctoral training, I worked with Dr. Kate Humphreys, who's an expert in understanding the effects of early adversity on infant and child development, but also parenting. And although our work tends to focus on early adversity and parenting, there's ample evidence to document the effects of early exposure to adversity on physical and mental health outcomes. In particular, higher risk for metabolic disease, higher risk for autoimmune diseases, and as well as psychiatric illnesses. And if we take an intergenerational transmission of parenting perspective or of adversity, parents who are exposed to high levels of adversity likely have children who are also exposed to high levels of adversity. And it's not unreasonable to think that this higher adversity exposure would be related to poorer health and well-being within children based on what we know about how it operates within adults. So taking all of this together, the current study had two main research questions. So first, what is the association between parental exposure to adversity and infant sleep? And then second, how do positive parental experiences also shape infant sleep health? And to test this, I used data that I collected in collaboration with Natalie at Nanit. And we collected data from 262 parents of 4 to 12-month-old infants. In addition to getting sleep data, we collected questionnaire data. So parents completed the ACEs questionnaire, so the Adverse Childhood Experiences, which asks about 10 events that may or may not have happened. Scores range on a scale from 0 to 10, with higher scores indicating higher exposure to adversity or adverse childhood experiences. Additionally, parents also completed the Protective and Compensatory Experiences Scale, or PACES, P-A-C-E-S, which asks kind of the opposite. So it asks about positive things that happen during childhood or factors that might promote resiliency. So for example, did you have at least one caregiver from whom you felt unconditional love? Did you have friends? Did you have a supportive system at school? So things that might promote resilience in the face of adversity. Additionally, parents provided up to 2 weeks of sleep data. To be included in this, we needed at least 7 nights. And we are focusing on 3 sleep metrics from that data. So first, total sleep time, second, night wakings, and third, parent visits to crib. So just going to visualize the data here for a moment. So if we look at total sleep time, we see that total sleep does decrease over the first 4 to 5 months of life, before increasing again steadily throughout 12 or up to 12 months old. And we see kind of the opposite pattern for night wakings, where night wakings increase over the first 4 to 5 months before decreasing back down. And then parent visits to crib are similar to night wakings, as one might expect. They increase to about 4 to 5 months, and then kind of level off to a slight decrease over the next 7-ish months. These are just interesting ways to visualize the data. So obviously these are not linear data. So I did test all of these multi-level models using a curvilinear assumption. And we'll talk about those results as we move on here. So first, looking at the association between ACEs and PACEs and total sleep, we found no association between ACEs and total sleep time. However, we did find that over time, yes, total sleep dipped for all participants around 4 to 5 months, but it dipped the most at that time for participants who reported lower levels of positive childhood experiences, suggesting that having more PACEs was associated with a lower decrease in total sleep time compared to lower levels of PACEs. When we look at night wakings, we found that higher ACEs was associated with more night wakings, and this was regardless of child age or regardless of time, and no effect of PACEs. Similarly, for parents' visits to crib, and this is not surprising that these two findings are very comparable, higher ACEs was associated with more parent visits. So more recalled adversity from childhood was associated with more need for parent visits and night wakings in babies. And again, this was regardless of child age. However, unlike night wakings, we also found an effect of PACEs here, such that higher PACEs was associated with fewer parent visits to crib. And again, this was regardless of child age. So just a quick summary. Over time, all sleep metrics, so total sleep, night wakings, and parent visits, peaked at their quote-unquote worst between 4 to 5 months before moving in a quote-unquote better direction. Although total sleep did dip at its lowest around 4 to 5 months, caregivers with more positive experiences dipped the least. And lastly, caregivers' early adversity was associated with more night wakings and more visits to crib, and positive experiences were associated with fewer visits to crib. So kind of thinking about what can we do with these findings, caregivers' early experiences tend to shape infant sleep patterns in the first year of life. However, the mechanisms aren't super clear. There are a couple different avenues of research that have been explored with but what might be explaining these findings. So first is prenatal programming of the intrauterine environment, and we'll talk about why that may or may not be relevant here in just a moment. It's also possible that past experiences are impacting current experiences, and that's actually what's impacting sleep. We didn't assess current experiences in this study, so that's certainly an avenue for future work. Another thing is that past experiences might be impacting something else that is then related to infant sleep. And again, kind of some limitations here. I've been hinting about these. We didn't differentiate between birthing and non-birthing parents. We included all types of caregivers, so we're not really able to assume that it's a prenatal programming of the intrauterine environment that's driving this. And secondly, we did not collect information on birth date. So we're relying on parent report of infant age, which so everybody just said their infant was X months. So that's why everybody's data is kind of towards the left end of their month range and then cuts off at about 2 weeks. I don't think that's impacting the results here, but it would have been more ideal to have a continuous assessment of child age, which we did not have here at the study. So some future directions that I'm really excited about. So I was recently awarded a pilot grant from the Center for Integrative Research in Childhood Adversity here at Oklahoma State University, where I'll be doing a longitudinal investigation of caregivers' early experiences in infant sleep. In particular, I'll be recruiting people during their pregnancy and giving them Nanits and tracking their infant sleep for 6 months. I'm really excited for this work. I should start this project in the fall. I'm really grateful for Natalie and Nana and their collaboration in this work, and perhaps in a couple of years, we'll be able to share some of those findings here. So hopefully I've wrapped up my class and I'm here and ready to answer some of your questions. So thank you all so much.
And there she is. Lauren, that was excellent. Thank you so, so
Thank
much for
you.
that. And we're very excited about the next project that you are about to embark on. So we're excited to see those results as well. I don't see any questions in the chat or in the Q&A. And I know that we're a little over time. So I'm very grateful to you for getting back from your class
Of
and being
course.
here.
They were devastated that I let them out 15 minutes early, I'll tell you that.
I'm sure they're devastated. I'm sure they are. But thanks so much to everyone. You know, it's always just such a pleasure to see this, everyone in this group I really adore and just love working with, and I feel incredibly grateful that I get to work with you every day. And I just wanted to let everyone know that anyone who's registered for the symposium automatically receives a recording of the symposium. So if you missed any of it, including you, Lauren, that you can watch it sort of any time at your leisure. So thanks everyone, so much for coming. And as a reminder, we're always welcoming new collaborations. So please reach out to me if anyone is interested in using Nanit in their research. And I look forward to seeing you all again next year. So thank you, everyone.